Hello, everybody, and welcome back. This is Grayson Harris, and today we are pleased to be joined by both Cleet Winkleman and Sam Guillory. Cleet is the CEO of the Babyfold, and Sam is both the VP of Development and Public Relations. Thank y'all both for joining today.
Thank you for having us.
Thanks for having us, Grayson.
Of course, really excited to dive into the mission and impact of the work you're doing out there. Cleet, can you give a little bit of context for our audience as to the work that you're doing?
Sure, be happy to. Well, our mission began in 1902, so we have been really serving the communities of Central Illinois for quite some time, coming up on our 125th year in 2027, and
So
it's
exciting.
really about it's a long time, and of course, Sam and I weren't here back then, but, we're the keeper of the mission now. In the Baby Fold, we're all about building positive futures with children and families, reflecting the Christian principles of love, hope, and healing. So
Mm,
everything we do is centered around love, hope, and healing. So really what the Baby Fold is, and again, it's evolved since 1902, started as an orphanage who now has grown to really doing nothing like orphanage work, but we are a very multifaceted human service organization serving about 26 counties throughout the middle of Illinois. So, Illinois is other there are other places in Illinois outside of Chicago. We're about an hour and a half south of Chicago. But what we do is really divided up into four key core areas. Academics, we operate two non-public schools for children with developmental disabilities, primarily autism. We do community schools work with the local school district. In our intervention services, we do foster care. We've got some prevention based programs that are really trying to keep kids out of foster care through community based programming. We get into then our early childhood, which to me is my favorite because that's where you can make the ultimate impact in a
mm,
family by getting involved even before the child is born with doula services, and then following that child and their family, providing assistance in parenting, developmental screenings, well check, really launching that family for success at such an early age. And we do a lot of things there with home visiting in the house with those children and their parents. We also serve in that area daycare centers.
mm.
You would think, why daycare centers? Well, a lot of children in daycare centers have problems, behavioral, mental health. They're coming there with trauma, and a lot of daycare centers aren't equipped to deal with that. So we've got 8 family therapists that are out there in daycare centers providing them consultation.
Love that.
Yeah, because we know the ripple effect if a child gets kicked out of daycare, a parent has to quit their job, stay home with the child. It just creates so many different challenges for that family to be successful. And last is uh, in our adoption work. While we have been known for years for our adoption, making sure we're finding forever families for kids, we don't facilitate adoptions anymore through private adoptions. We still do adoption conversions in foster care. But what we do in our adoptions area is to really support that family who has taken that big step about adopting a child and then
Mm,
making sure those children successfully integrate into that home and supporting the parents as well as the child. And one of the ways we support the parents beyond just services, we actually do a respite camp out in a lake. Parents can drop their kids off for 3 days. They get a little break, and the kids have a wonderful experience. But key to those kids and their journey is they a lot of times meet a child who's adopted just like them for the first time at that camp because it's only designed for kids who have been through the adoption process. So we do all that in programming with our amazing staff of about 260
wow.
employees with 7 sites throughout Central Illinois, and then we also take the show on the road and do a lot of training and consultation with school districts, with other providers in the area, sharing what we do and how we do it, and hopefully they can walk away feeling a little bit better about the work they're doing. So that's the Baby Fold from a high level.
Yeah,
So we do a lot.
that's incredible. And what just came to my mind as you laid out all these incredible programs, right, is that you really are living these values, these 3 core values of the organization through all the work that you're doing. And Sam, I would love if you could describe for me and our audience, how do you try to communicate, the values that your organization lives whenever you're both talking to your constituents, the parents, the children, the youth that you serve, but then also the broad community out there in Central Illinois, in terms of your donors and your corporate sponsors. What does that look like?
Absolutely. Well, having an organization that's been around for nearly 125 years and has been a foundation in our community can present challenges because the
Mm.
community, if you ask, do you know the baby fold? All hands go up. They say, I know you, I love you, and I have no clue what you actually do. So that's where we come into play. And we explain that while the Baby Folds non orphanage that we were 125 years ago, the reason that we've evolved and that we've changed is to meet these emerging needs of the community. I always say the one thing that's remained consistent in the Baby Folds history is evolution. Because if we didn't evolve, then the community wouldn't need our services. So that's constant evolution. One thing that we did a few years ago was try to really organize our services into these 4 primary service areas like Cleet just talked about to make it more understanding. When someone asks, "What does the baby field do?" The easiest way to explain it is, "We have something for everyone." I say, "Give us a call and we'll get you taken care of." But when it comes to communicating that message and that information to your constituents, I believe that communication needs to be tailored specifically to who you are speaking with. If I am talking to someone who has an adopted child, then that person probably wants us to highlight our post adoption services more. Whereas if someone else knows or has been experienced or exposed to someone on the autism spectrum, then we'll highlight those service areas instead. So when it comes to communication and fundraising, I truly think a key is to have your spiel. You'll have your elevator spiel, but then you really need to listen more than you're talking. Understand what is it that that constituent is interested in or what inspires them, and really lean into that and highlight that instead. Because Grayson, if you were adopted, then you probably care and want to learn more about our adoption services. And if I'm just here talking to you about our special education schooling, it's like I don't know you and I'm not hearing your needs. So that's why you have to tailor that communication.
Thank you for that answer. And something that also has really come across from some of our conversations is the creative aspect of that really comes about whenever you are listening. Can you tell me a little bit more about that and maybe share a story where that really came into play?
With the creative aspect,
Yes.
yeah. Tell me more about what you're looking for.
Of course. So whenever you're, talking with a donor and you've kind of explained the values that you have in your organization, and they're looking to kind of fit that in terms of, sorry, they've explained kind of the values that they have as a donor and an individual, and you have these specific needs. I think you had shared a story about kind of creating a new education campaign. Can you share a little bit more about that?
So what I hear you saying, Grayson, is I think one of the beautiful things we're able to do is blend our donors' needs and their passions with institutionally what our needs are. So the baby folds operational needs with my donors' passions. So if I can tell that short story, I had a donor that came to the baby fold who was interested in making a wonderful charitable contribution. What this donor was interested in donating is something that didn't necessarily align with our initiatives. So, what I was able to do was circle back with the donor and again ask, tell me more. Tell me why you're inspired to do this. What they wanted to do was to donate multitude of magnitude of little library. And after talking to that donor, I learned that her mother was a librarian and that she has a connection to educators and to literacy. And after learning that, I was able to connect with her and explain that while we don't necessarily need 20 or 30 little libraries all across our campuses, what we really could use is our improved literacy curriculum. So What if instead we were able to use this donation for a literacy curriculum? So I feel like what you have to do is you have to listen to your donor stories and be aware of the funding initiatives of the organization as well. If we had a donor come in and wanted to make a sizable donation, but it was for dogs or for something that's not on mission, that's why you really have to listen to them, know where their heart is at, where it's coming from, and then connect that back to the agency and our needs because you always want that donor or that constituent to leave with a positive feeling. I feel like no one will remember what it is you're telling them. They might not even remember what their donation went to, but they will remember how you made them feel. So finding that passion and being able to connect that passion to our operational needs.
And I love that story because I think there's so much that can be replicated across the nonprofit space through that and the sense of really listening in and connecting the dots for them as well and being that kind of bridge between the needs of the constituents and then the needs of the donor.
Absolutely, and I think that's our job. I view myself as I'm just a tour guide for the baby fold. I have my amazing donors come. I am blessed to be able to hear their stories and to hear their passions and what inspires them. And then I connect that dot, and as the tour guide, I guide them to the needs that are available at the baby fold, and we get to bless them because they get this amazing sense of fulfillment and joy, and giving fills their cup. So when it comes to fundraising, I know not everyone can ask, but I always feel like it's a blessing because we are giving the donors the chance to do good. And that's what everyone wants to do. You want to do good in life. And we're just lucky enough to be able to have them do it for our organization.
Thank you for that context and that answer. And I'd love, there's so many moving pieces, right, with the baby fold. You mentioned you'll have over, I think, 250 different employees. Could you give me some more context into what it looks like in terms of, you know, maintaining a mission aligned and bot and staff and some of the strategies that you're using within the organization?
Sure. Before I get to that, I want to add to something that Sam said. So while she is the tour guide for our donors, it's critically important that development isn't seen as an outside arm of the organization just raising. Sam is embedded in our leadership team. She's involved in our budgeting process. She needs to know not only what people's wish lists are, but what also the needs of the organization that we're budgeting for, because we can certainly take a donation and purchase a budgeted item and use then those resources in a different way for a different agenda. So just really making sure there's alignment between what you're raising and what the organizational needs are. So, but we love her being our tour guide because she is great and her team is great about really that donor experience of making them feel very good. So, how do we get our staff moving all in the same direction? Is that your
Yeah,
ask?
and really kind of getting, so nonprofits across this sector, right? Staff retention, turnover is oftentimes a challenge within the nonprofit space, especially within human services. So I'd love if you could give some context into the strategies that you're using within the baby fold and any advice or lessons that you think would be replicatable for other nonprofits in the space in terms of building a bot-in team and keeping that retention.
Yeah. Well, I hear this a lot of the challenges of retaining staff members at the organization. And, to be honest, we have made great strides in that area. I would not say that we are in that state. And I think it's because of some of the things we're doing. I'll equate it to Sam being the tour guide for donors. What is she doing there? She's really communicating and listening. I think the same principles goes true to our staff as well, being able to listen to what they want and to really be very communicative. We have so many levels of communication. I do an end of the month update to our staff. That's not unique, but it is transparent. It keeps people kind of, hey, I didn't know that was going on over at that site, right? Hey, good to know. So there's communication at all levels. We do a 411. We welcome staff. We send out communications about transfers, motions. We hold all staff meetings virtual because of how spread out we are. Just really try to over communicate. Our strategic planning process, we just launched a new strategic plans July 1. We've got a whole page on our intranet home page that can provide feedback, They can go on there and look at what our updates are when it comes to progress on our strategic plan. So it's really being transparent with our employees. So that's the communication piece, but now you're hearing these messages, what do you do with it? And so, we've tried to be we are more transparent than we were 2 years ago, probably 5 years ago, and we'll continue on that path. But some of the things we've also done in this line of work, there's a lot of vicarious trauma, secondary trauma that our staff face. I equate our staff in human services here at the Baby Fold is no different than first responders. Our staff run into situations, are involved in situations where most people want to run away from.
Mm,
And so they're embedding themselves in circumstances that they may not be equipped to deal with and may never have experienced and creates trauma for them. So what do we do with that? Well, we use a program called Headspace. It's a virtual wellness platform that has meditation. It's got instant access to a therapist. It's got instant access to a virtual real person psychiatrist. So we have layered on benefits. We have tuition forgiveness programs. We have a program where staff can get interest free loans for their medical bills and
mm.
vet bills for anyone that has furry loved ones, such as Sam. But she's got a beautiful dog, Penelope. Petunia. Sorry, I did it again, Sam. Petunia. Um, so from the benefits side, we're really looking at it from a how can we support our staff in a better way to reduce the stress that they are dealing with from day in and day out. We're constantly reviewing our compensation program. We make significant investments, trying to do all that we can to be as competitive in the market as possible. So it's a culture piece, it's a
Mm.
transparency piece, it's a benefit piece. It's being out in the buildings, being seen, being listening to what people are saying. There's no simple answer to the question. All I can say is that in today's times, leadership needs to be much more visible and much more willing to listen to their staff than ever before in my entire career.
Thank you for that. I think that was great context. Sam, did you have anything to add on to that?
Yeah, I would say, Grayson, if I can add to that, everything Cleet's saying is completely true. And what I would add is, as a leader, you have to know your people. You have to know your people so that you can motivate them. Because what motivates or what inspires me is probably different from Cleet and different from you as well. So if I'm just going to use a small example here. If you're bringing in a box of donuts, anytime a box of donuts will motivate me. I love the little sweet. But if it's the 1 week a year I'm dieting, you just had the opposite effect on me then, okay? So you have to know your people. I know that's a silly example, but think of it this way too. The baby fold has been very intentional about building tunnels and ladders because, yes, some people do want career advancement. However, it's up to you as a leader to know your people and to know who wants that advancement. Because if you're making the assumption and you think you're being a good leader, by giving this person this promotion and it's not what they want, again, just like my donuts, you're going to have the opposite effect. So you have to know your people, reward them, and don't forget to have a little bit of fun too. Petunia, my Saint Berdoodle, comes into the office, or maybe we'll just have a 5-minute dance party. You have to have the fun in the office too, because we're all people, we're all humans.
Thank you for that. I'd love to, we've talked really on the staff piece. I'd love to get y'all's perspective because the baby fold is, one piece of this broad puzzle in terms of supporting the needs of the communities that you serve. What does this community collaboration look like? And what is y'all's perspective? I'd love to get, both Sam and yours, Cleats, kind of perspective on that community collaboration and buy-in within Central Illinois.
Yeah. I just talked about this the other day in a association meeting. Our community, McLean County, which, many of your listeners or viewers won't know where McLean County is. Well, it's the hometown of Illinois State Redbirds, Illinois State University, and it's where Rivian cars are made. So that might give a little context. It's a community of about 140 people, two towns side by side. Bloomington, Normal are the two biggest towns in McLean County. I say that because McLean County is unique. McLean County, and I've worked in many other places throughout Illinois over my career, and it's unique in the sense that there is collaboration and it's real collaboration. It's not this, yeah, I'll shake your hand, but those are words only. Truly, if there's an issue in the community, we come together as a provider sector and say, how are we going to solve that? We don't wait for the feds. We don't wait for the state to come with money and solutions. We try to figure it out ourselves. And how we do that, there's a behavioral health coalition that's made up of social service agencies all throughout the community that's really brought together under the umbrella of the McLean County government.
Okay.
So there's one option. There's provider groups that come together to say, "Hey, we have a mental health crisis. We don't have enough workers to support the work we need." The chamber's involved. How is the chamber now is involved in trying to recruit members to our community with backgrounds to help with the workforce issue around mental health. We're working side by side with the universities, Illinois Wesleyan, Illinois State University, about workforce retention, meaning these students come, then they leave. Well, how do we keep them here in the community? And we talk about ways to enhance internships and embed them in our organizations with the hope that they'll be motivated enough to stay in Bloomington Normal. So
Love that.
it really truly is about we'll take care of our community ourselves. We're not waiting for somebody to come and help us with the problems. We actually stand up and say, we're going to take it on and we're going to figure it out ourselves.
I definitely have a follow-up question on that, Sam. I'd love to get your perspective from kind of that more development seat.
Yeah, absolutely. I think what Cleet said was amazing because the other part of that too is that the baby fold also reaches out to the community and we're asking the community, how do you need us? We've talked about our evolution throughout the years. So, one thing as we look at our future and as we plan for the strategic next steps, we actually are connecting and collaborating with our community and asking what needs are out there. Because if you're working siloed and you're thinking, well, we do this really good so we can amp up this program or we can create this program. Well, does the community truly need it?
Mm.
So I think on the flip side, not only are we stepping up and we're working to serve our community, but also we're helping each other. Now, from a development perspective specifically, I feel or I think about community relationships and community collaboration the same way that I think about our donors.
Mm.
I want to listen, hear what your needs are, and then determine how we can meet those. Again, just like I was talking about as part of our strategic plan or strategic exploration, that's a great example of surveying our community or surveying local school districts to determine their needs and then taking that information into consideration as we think about the steps in the future. So we are doing that. And additionally, when it comes to philanthropy specifically, community foundations or community organizations sometimes have a specific amount that they need to be charitable with every. So that's why we need to make sure that they're aware of the baby fold and our services. But it doesn't just end with a donation. So many times businesses are able to donate their time and have volunteerism and give back to the community. So you want to also open up your arms or open up your doors and provide volunteer experiences as well. Because people can give
Mm.
not just financially, but also through their time and their talents. And giving through time and talents is statistically speaking, one of the best ways to lead to a financial or a donation of treasure after time and talents.
And Carl, thank you for that context. And the follow-up question I had, Cleet, as people are looking to their communities, their towns, what would be a piece of advice that you would give to them as they're looking to build this, idea and foster this collaboration between leaders? Would it be to create a group, kind of like as you were saying, get change makers in a room together? What would be your thoughts there?
I think it really starts with a commitment to building relationships with the leaders of those organizations. When funding is tight, people tend to build bigger walls, right, to protect themselves. My philosophy is when funding's tight, that's the time to talk about how can we divide this up in an equitable way to enhance improvement or enhance impact. Now, how do you do that? I think it really comes down to relationships. I mean, it's no different than the relationship you build with a donor. It's got to be true, it's got to be trustworthy, and it's got to be honest. And if leaders in your community are willing to come together under those principles and those values, then I think it begins to happen. But so many times people are building their fiefdoms and not willing to step out and build those relationships. But doing so also prevents the opportunity, such as what happens here in McLean County, and that we're solving our own problems. If
as well. It's
yes,
a rapid response is what it really sounds like. You're able to adapt, to the community's needs because y'all are the ones that are directly working with them.
I mean, how many times have you heard in your podcast, hey, the county government came to us as providers and said, we have a problem, help us solve it? How many times have you heard that? I'm guessing not very many times. They put these funding streams out for requests for proposals and everybody competes for it. Well, they bring the right people to the room and say, we've got this issue. Help us think through a solution and we want you all as partners. And that's, I think, what makes McLean County unique in that there is that level of trust across all the sectors. And we have opportunities where those relationships do exist and they're trustworthy.
Thank you for that context. And I'd love as we come to an end of the show, if you could tell me a little bit more about what the future brings for the organization. What does the changing needs and how are y'all strategically thinking about that and what's next for the baby fold?
Yeah. So our strategic plan is really pillar, our three pillars are people, property, and programs. So when it comes to people, it's all about building a culture of trust, relationship, and making sure that we're doing all that we can to support our staff who are vital in impacting the lives of children and families. So that's the people side of it. The property side of it is we're trying to figure out our footprint as we look to the future, and that's got a lot of complexities in it. Out of 7 locations, we only own 2, and the 2 that we own are big campuses with much acreage. So why do we need all these other leased properties? So we're trying to figure that out. And then when it comes to programs, we have several in the hopper that we're looking at that are going to stay true to our mission. And that is about bringing about, I mentioned mental health is a top priority in our county. Well, we also know that autism is a big need and we serve that population in our schools. We're looking at developing a outpatient clinic specific for kids with autism and developmental disabilities. So that's one area. We're also looking at some other things that are more community focused that really bring the service to the front door of someone's house. We don't ask our clients to come to us, we go to them. That's what makes us unique. So those are 2 big areas that we're thinking about and being more strategic in our focus going forward over the next 3 years.
Thank you for that. And Sam, for our nonprofit audience, what would be a final piece of advice or a lesson that you'd want them to leave with?
Listen and know your people. And when I say people, I don't just refer to your team members, but you have to know your team so you can respond to them, but also listen to your donors, listen to your constituents, and continue this collaborative culture. Because just as Cleet was talking about what the future looks like for the baby fold, the future of our organization is hand in hand in line with our development and advancement opportunities. So
Mm,
that way we can work together jointly so that we can execute those needs and serve more kids and more families than ever before. So make sure that you take care of yourself and take care of those around you, and it looks different for everyone.
amazing. Thank you. And Clete, how can our audience get involved with the baby fold?
Man, well, hit us up on our website, thebabyfold.org. That's easy to do. And we have an amazing social media presence, all your socials, Facebook. It really, Sam's team does an amazing job at telling our story. They can make donations straight through our website. We've got our 32nd annual Festival of Trees coming up.
Yay.
Kicks off the holiday season the weekend before Thanksgiving. It's our largest fundraiser of the year. That we'll have about 10,000 people that visit over those 2 days, and
Wow.
it's going to be a fun event here in the community. Sam's team is all over it. We start planning it, or they start planning it the day after this one concludes. So there's
A
plenty.
year-long process. That's exciting.
It is.
So if anyone's out there needing a tree, they can get online and check out what our auction items are. There's how many trees? 700 items that are going to be up in the auction.
We usually have between 7 to 800 auction items, or if you can't come out because I know your listeners are widespread, you can consider adopting a child's Christmas wish list this holiday season. So instead of
Amazing.
Friendsgiving, instead of another ugly Christmas sweater, which no one needs, instead of that Christmas exchange at the office, you could consider being philanthropic, giving back to those in need, and adopting a child's Christmas wish list, which you can do whether you're in central Illinois or coast to coast. Feel free to just reach out, visit us online at thebabyful.org. And again, we would love to connect you with whatever you're passionate about.
Thank y'all for coming on and sharing more about the work and impact and mission with our audience.
Thank you, Grayson. It
Thanks
was
for
a
having
pleasure.
us.
Yeah, thank you.